Hi, everyone. So I think we're ready to begin, but firstly, I'd just like to ensure that everyone can actually hear me. So if you can you please type yes into the chat box, which you'll find on the left-hand side of your screen? Amazing. Great. Okay, I just wanted to make sure. And perfect. It appears you can all hear me, so that's fantastic. So welcome to Asthma Canada's Asthma Basics webinar series. Our webinar series has been made possible through educational grants from AstraZeneca, Novartis, GSK, and Sanofi Genzyme. So today we're getting back to basics with the second part of our webinar series that focuses on asthma triggers. So this webinar is both for people who are newly diagnosed and for those who have been living with asthma for a long time or their caregivers. For many members of our community, I know the pandemic has highlighted, just how important maintaining asthma control is, not to mention taking care of your overall health. So I know many of you have been looking forward to this presentation. My name is Kristen Vawa, and I'm the Manager of Communications, Programs, and Public Engagement at Asthma Canada. So before we get started, I'll just go over a couple quick points. This webinar is being recorded and will be uploaded to our website shortly, so feel free to share within your networks once the recording is made public. And all attendees are muted, but at any point, if you have questions, comments, type into the chat box, which I'll be monitoring throughout. There's also a little blue question mark at the top of your screen. You can also type your questions there. And there will be a Q&A at the end, but absolutely type any questions in as we move throughout the presentation. So very quickly, I'd just like to highlight some of our work. Asthma Canada is the only national organization solely dedicated to helping all Canadians affected by asthma. At the heart of all we do is our vision to empower every child and adult with asthma in Canada to live an active and symptom-free life. We're committed to improving the lives of the Canadian asthma community through education and support services, advocacy, and research. Asthma Canada encourages self-management by helping our community take control of their symptoms. We do this through our educational resources and services like our Asthma and Allergy Helpline and our webinar series, just like this one. We're also committed to bringing your voice to the forefront of policy decisions that affect our community, advocating on important issues like sustainable clean air and energy, choice and access to treatments, and access to medication in schools. And of course, Asthma Canada supports research into better health outcomes and the eventual cure for asthma. Our national research program supports graduate level students studying early or late onset asthma. Much of the work we do is through our community of volunteers and members across the country. People living with asthma, their families, parents, caregivers, healthcare professionals, educators, and others who are strongly committed to improving asthma care and quality of life. The Asthma Canada Member Alliance is a free membership of Canadians who engage in all the work we do and who provide support and input into our initiatives. So I absolutely welcome you to join us if you haven't already. And I am so pleased to introduce our presenter today, Stacey McNeely. Hi, Stacey. Stacey is a registered respiratory therapist, certified respiratory educator, and certified tobacco educator. Stacey works in a community hospital in Maple Ridge, BC, as the asthma clinic educator, pulmonary rehabilitation coordinator, and the lead for the smoking cessation clinic. Stacey's experience includes working as a respiratory therapist at BC Children's Hospital, as a therapist and ECLS specialist, and at King Faisal Specialist Hospital and Research Center in Riyadh, Saudi Arabia. As an individual living with asthma herself and working for over 25 years in the field, Stacey has a profound appreciation for how difficult it is to suffer with lung disease and is an incredibly strong patient advocate. Stacey has been involved with Asthma Canada for a number of years in various advisory roles and currently sits on our Medical and Scientific Advisory Committee. So thank you so much, Stacey. It's a pleasure to have you with us today. I'm happy to turn the presentation over to you.
Oh, thank you, Kristen. And a big thank you to Asthma Canada for having me today. Before I start, I would like to recognize we are conducting our business today on the unceded and traditional shared territories of the Katzie and Kwantlen First Nations. So our goals for today. We're going to talk about the basics of good asthma control, and we're going to learn the difference between allergic and non-allergic triggers, help you identify things in your environment that might trigger your asthma and ways you can avoid them, and empower you to take control of your asthma. This presentation is based on the Asthma Canada's Breathe Easy Triggers booklet, so you can always look back as a reference and you can find it online. What is good asthma control? It's important to understand what good asthma control means so you know what to aim for. People tend to see frequent asthma symptoms as just a part of having asthma, just a part of their normal daily life, but it doesn't have to be that way. You can and you should aim to live symptom free. So good asthma control means you do not have breathing difficulties on most days. We go by our Canadian Thoracic Society guidelines, and what they recommend is you should have less than 2 days per week of daytime symptoms and mild daytime symptoms. Good asthma control means you do not use your blue puffer, your reliever medication, which is your Ventolin, salbutamol, Aramir, Bricanol, whichever one you have, more than 3 times per week. You can exercise without any symptoms, chest tightness, coughing, wheezing, short of breath. Physical activity should be completely normal if your asthma is well controlled, as well as sleeping through the night. The CTS guidelines recommend less than one night per week of awakening with mild symptoms is acceptable, but if it's any more than that, your asthma may not be well controlled. And you should not be missing any work or school. Ways to determine if your asthma is well controlled. First of all, talk to a trusted health professional about your symptoms, your GP, nurse practitioner, specialist, whomever you may have, and consult your asthma action plan. We use the asthma action plan a lot with our clinic here. So what the action plan is, most of you may have seen it. It's like a stoplight, green, yellow, and red. So in the green zone, you're well controlled. That's what you're doing on a daily basis when you feel great. Your symptoms are well controlled. You know that everything is going okay. You're taking your regular medication if you have any. And then if anything changes and you start to have more symptoms, something's changing, you go into your caution, your yellow zone. And that's when you may have an escalation in therapy as far as medications, taking your reliever medication more often. And then if it changes and goes into the red zone, you're in trouble, and that's when you need to get help. So the action plan is quite a powerful tool, and we'll talk about that more throughout the presentation. There's also rateyourreliance.ca. It's a tool to check how often you're using your reliever medication and your thoughts and attitudes towards it. And Asthma Canada's Asthma Control Digital Toolkit as well is a fantastic tool. So what are some reasons your asthma might not be controlled? If your asthma isn't controlled, there are different reasons why. You might not be using the right controller medication. There's so many on the market. So if the one you're using isn't working or you have concerns with the technique or the device, talk to your physician or your healthcare provider because you can always try something different. We change around medications on a regular basis if there's concerns until we find the right one for you. If you're not using your controller medication as prescribed, if it says take it morning and night, make sure you're doing that. A lot of medications are 12-hour medications, and so you need to take it as prescribed for it to work as best as it can. You might not be well controlled if you're not using the right inhaler technique. Every time I see someone in the clinic, I check the technique, even if it's their 12th time in. There's always something you can tweak or suggest, and you never know. Sometimes technique slips over time as well. There could be something other than your asthma causing your symptoms. And if you are exposed to something in your environment that is triggering your asthma. And that is the basis of our talk today, asthma triggers. So asthma triggers. Triggers are things in your environment that cause worsening of asthma symptoms or asthma attacks. Another word for asthma attack you might hear is asthma exacerbation, asthma flare-up. Avoiding triggers that are under your control will help you better be prepared to deal with the triggers that are difficult to avoid. Things like pollen, bad pollen days, cold air, smog, wildfires, smoke, exposed to an animal you weren't expecting to be. There's two types of triggers, allergic triggers and non-allergic triggers. And we're going to talk about both in quite a bit of detail. So your allergic or your inflammatory triggers set off an allergic reaction and cause inflammation of the lung airways or tightening of the airway muscles. Inflammatory triggers can be things such as dust mites, animals, cockroaches, molds, pollens, trees. We're going to talk about all this stuff as well. The non-allergic triggers, the symptom triggers, generally don't cause the swelling or the inflammation, but they can provoke the twitchy, irritated airways, especially if there's inflammation already there. Some symptom triggers: smoke, exercise-induced, cold air, chemicals, strong odors, fumes. Scented laundry products is a big one, emotions, stress. Determining your triggers. It's important to find out what allergic and non-allergic triggers you may have so you can take steps to reduce or eliminate your exposure so you don't make your asthma worse. Talk to an allergist if you think you may have allergic triggers. They can help determine those. And the non-allergic triggers are a bit more difficult to determine. It just takes a bit more time and effort, but it's possible as well. Asthma and allergies. Asthma and allergies are related, but they are not the same thing. I often talk about the triad of eczema, asthma, and allergies, and they're all kind of related. They're all kind of connected. An allergy is a reaction to a substance that is usually harmless. These substances are known as allergens, and they can be inhaled, injected, swallowed, or touched. Being exposed to an allergen may cause irritation and swelling in specific areas such as the nose, eyes, skin, lungs. Things like pollen, animal dander, dust mites, and mold can make asthma symptoms worse by increasing the inflammation of the airways, which makes them more sensitive and causing them to narrow and get constricted, hence the symptoms. We're going to talk about the types of allergic reactions, and we're going to talk about three of them: anaphylaxis, atopic dermatitis, and rhinitis. So first of all, anaphylaxis. Anaphylaxis is a severe, sometimes life-threatening event, and it requires immediate medical attention. Symptoms of anaphylaxis occur suddenly, and they can include a combination of the following: difficulty breathing, hives, tightness or swelling of the throat, hoarse voice, nausea, vomiting, abdominal pain, diarrhea, dizziness, fainting, low blood pressure, feeling of doom, like something isn't right, and cardiac arrest as worst case. The second allergic reaction we're talking about is atopic dermatitis, eczema, related to an allergic reaction. So atopic dermatitis, which appears as dry, itchy, red patches of the skin, is often the very first atopic allergy-related disease to appear in infancy. You can see this poor baby in the picture. That's typical. My daughter, who is actually on here today listening, she had eczema at 3 months old, and it's like, okay, here we go. History of allergies and asthma in the family. So at that point, and we're going to talk about this more, I changed my laundry detergents and did everything I could, right, to get on top of it. Many young children will develop, or who have atopic dermatitis, will develop asthma and allergies months or years later. It's often the first sign. So types, the third type is rhinitis, allergic reaction, and that is inflammation or swelling of the lining in the nose. It can be caused by exposure to allergens such as trees, grass, ragweed pollen, animal dander, dust mites, mold spores. And the common symptoms of rhinitis is that itchy nose, throat, runny, stuffy nose, sneezing, ear blockage. Allergic conjunctivitis is a term for itchy, watery, and red eyes due to allergen exposure in the environment, and they can be seasonal. A lot of allergies are, but some may occur throughout the year. So when you have asthma, breathing an allergen into the lungs leads to swelling or inflammation of the lining of the airways. So asthma is inflammation. Think of that as inflammation. And this causes the symptoms of coughing, chest tightness, wheezing, shortness of breath, sometimes mucus production. I often describe it as if you had swelling someplace in your body, like your arm, you would see it, you would treat it. Asthma is inflammation in the lungs. So you can't see it, but you have the symptoms. So the inflammation is causing these symptoms. Although allergens are common asthma triggers, many people get asthma symptoms have non-allergic triggers as well. We're going to talk about non-allergic triggers. So first of all, the allergic triggers. Always try to get these confirmed by an allergist. I know it's difficult to get into specialists, and the pandemic has not helped that, but the allergist can definitely diagnose. You can see the picture of the skin prick test, and that's a common method of trying to figure out which allergies you are sensitive to. So exposure to allergic triggers may cause inflammation in your airways, which makes your asthma worse. The common asthma or allergic triggers, are dust mites. That's number one. Mold, pollen, food, and animal dander from pets. We'll talk about each one of these separate. Dust mites, and that's a lovely picture of a dust mite. Dust mites are a common allergic trigger. Dust mites are tiny insects that live in your carpet fibers, plush furniture, curtains, mattresses, pillows, bedding. I always say you're never sleeping alone. They like to congregate to live in soft surface places where there is an abundance of food supply, also known as your bed. And they like to eat your dead skin flakes, your dead skin cells. And that's what they eat, and then they reproduce in the warm, humid environments. So what asthmatics or people with allergies to dust mites, it's their dust mites excretions, their feces, and their body parts that can be a powerful trigger for asthma symptoms. So using a dehumidifier if it's quite damp, and we always recommend having humidity ideally between 40 and 45%, less than 50. If it's over 50, thinking about a dehumidifier is an idea. You can get a hygrometer to measure humidity, and you can buy one of those at a hardware store. Removing carpets, especially in the bedroom. And we're going to talk about this throughout this presentation. As far as carpets, they're a big harbor of dust mites. And washing your bed linens in very hot water weekly. Encasing your pillows, mattresses, box spring in a allergen cover or mite allergen impermeable casings. And you can buy these, they're not as expensive as they used to be, and they fully encase your mattress and they zip up. They're really difficult. They're not like a pad. They fully encase, zip up, and I often recommend to my patients to get a piece of duct tape and actually tape over the zipper so they're fully encased inside the mattress. Another allergic trigger is mold. Molds are fungus that can be found just about anywhere where it's damp and where airflow is minimal, like your basements and bathrooms. These airborne spores can trigger asthma symptoms. It's important, once again, to monitor the humidity levels in your home with the hygrometer and keep the level between 40-45% humidity. Make sure your home is well ventilated. Remove carpet wherever possible, once again. If carpet is kept, if you can't remove it, a lot of people are renting or it's not possible to remove it, just make sure you vacuum on a regular basis and frequently using a vacuum cleaner with a HEPA filter. Cleaning moldy areas, especially in the bathrooms, with an anti-mold cleaner like vinegar. It says here chlorine bleach. We don't recommend asthmatics go close to bleach and chemicals, so try to get somebody else to do this for you, delegate. And when using these chemicals, just make sure it's well ventilated. Proper drainage around your house. Use bathroom and kitchen fans to improve the ventilation, and reducing the number of house plants because they can also harbor mold. Pollen, another allergic trigger, very common. It's a very common allergic trigger. They're generated by trees, grasses, weeds, and are carried by the wind on hot, windy days. They're easily inhaled, especially during warm weather months, and trigger asthma symptoms, and some people even have attacks when the pollen count is quite high. The exact timing of allergy season depends where you live in the country. Most regions of Canada, it follows the tree allergens in the spring, grass in the summer, and ragweed pollens in the fall. If you're allergic to pollen, there's a number of things you can do to stay healthy. Check your pollen count and stay indoors whenever it's high, especially on windy and stormy days. And avoid activities that put you in direct contact, such as mowing the lawn. Once again, if you can delegate, using a HEPA filtered air cleaner. on days when the pollen count is really high, keep your air conditioner on in your home and car and keep your windows closed as much as possible. If you normally exercise outdoors, consider exercising inside on days when the pollen count is high. And if you are outside, shower and change your clothing after you've been outdoors once you come back inside. Some plants in your yard may trigger symptoms if they have a high pollen producing. So trying to get lower allergen plants, using a good furnace filter and changing it on a regular basis. Try not to plant trees or plants near the air intake of your furnace or air conditioner. Not hanging your laundry outside to dry in high pollen counts, using a clothes dryer or hang it inside on the racks inside. Don't touch plants that you think might be triggers. And if you do, just wash your hands right afterwards. I tend to get hives on some of the plants in my yard, so I wear gardening gloves. Food, another big trigger for some people. A food allergy may cause skin problems like itching, rashes, hives, or intestinal difficulties with abdominal pain, diarrhea, vomiting. And it can also cause anaphylaxis, food allergies such as nuts and whatnot. So getting tested for food allergies, talking to your allergist or your healthcare provider, and learning how to avoid the foods that you are allergic to. Animal dander. So people with pet allergies are mainly allergic to the animal's dander, their skin cells, the flakes of shed skin, their saliva, and their urine. It's not the hair. These allergies are to very small particles. The allergens are very small particles, sorry. And even in the air, it can last for months after the animal is no longer present on furniture and in carpets. The animals can also carry pollen and mold into the house from outside on their fur. If you have asthma and a pet allergy, reducing your exposure is the most effective way to help your asthma symptoms. If you don't have a pet and you know you're allergic, you may need to consider or think twice before getting one. And if you have a pet and a pet allergy, they consider finding a new home for your pet. I get it. Pets are our family. So I always try to work with my patients, and we'll talk a bit more about this, but the number one thing is getting your pet out of your bedroom, keeping your bedroom your safe place to breathe, getting the carpet out, and doing what you can to control that environment. There's no such thing as an allergy-free cat or dog or hypoallergenic. There's less allergenic, but not allergy-free. They all have the skin cells and urine and the reactions. So managing asthma with pets, have somebody else wash it twice a week. Removing carpet throughout your home, especially your bedroom, as they trap the allergens like fur and dander. Creating no pet zones. Keep your bedroom off limits, like I mentioned already, as well as any carpeted spaces. Keep your pets restricted to areas that are easier to clean, such as hardwood floors, and keep them off furniture and surfaces that could trap in the allergens. Cleaning the house on a regular basis with a vacuum or a HEPA filter, a central vac system with an outdoor exhaust. And we talked about the mattress cover already, the allergen cover, encasing your mattress and pillows in special allergen-proof covers, as well as a HEPA air filter or cleaner in your bedroom if possible. So now we're going to look at the non-allergic triggers. We just finished looking at some of the allergic triggers. So not all things that trigger asthma symptoms are allergens. The non-allergic triggers tend to cause irritation that may increase symptoms, especially if the airway is already inflamed, already swollen and sensitive. So the common non-allergic triggers of asthma are exercise, tobacco smoke, viral infections, respiratory infections, cold air, weather changes, smog, fumes, odors, strong odors, emotions, medications, indoor air pollution, and hormones. So we're going to talk about each one separate. So exercise. Having asthma does not mean you have to limit your physical activity. If your asthma is well controlled, you should have completely normal physical activity. If you have any limitations to your ability to exercise because of your asthma, it's probably not well controlled, and talk to your healthcare provider about this. They say there's a tendency to breathe through your mouth when you exercise, so that's unfiltered air, which can trigger asthma symptoms as well. Tobacco smoke, we know that's a big non-allergic trigger, whether it's first-hand, second-hand, third-hand, any smoke. vaping, marijuana, anything you inhale into your lungs can be a trigger. So second and third hand smoke can trigger asthma in infants and children. You think about if you have a third hand smoke, if you've smoked, it's on your clothes, you come inside, you're holding a child and they're close to your clothes, that could be a trigger for a child as well. Cigarette smoke increases the number and severity of asthma episodes. I'm also a tobacco educator. This is a topic close to my heart. Talk to somebody about trying to get help and talking to somebody. I think most provinces have a quit line or a quit program. BC has Quit Now. It's online, referral, phone, text, and they're great supports to give you ideas on how you can cut down, reduce, and eventually quit. Another common non-allergic trigger is infections. Cold and flu viruses are normally common asthma triggers that are difficult to avoid, but thanks to this pandemic, public health measures, we've actually cut down our exposure to colds and flus. We know that the public health measures work. Wearing a mask, washing our hands is the big one, keeping our distance, have a real impact on the spread of these viruses. I was just talking with a coworker at Children's in BC, and we're starting to see an increase in viruses right now with the children. As far as we're seeing some rhinovirus RSVs making a resurgence, or some colds going around. We're all back in school again, back in indoor spaces. So these public health measures do work, so really emphasize that. If you have asthma, it's recommended to get your flu shot. Use your controller medication on a regular basis as prescribed to help reduce your asthma symptoms. If you do get a cold, follow your action plan. Antibiotics will not help asthma attacks caused by colds, but they may help if you have a bacterial infection. The third week of September is, we call this September peak, the September spike. So typically, third week of September, we see the most asthma-related incidents in our emergencies. Everyone's back at school, like I said, and in indoor spaces. I'm not sure what's happening right now with our asthma in our emergencies, but typically that's what we see in September. So it's good just to be on top of your action plan and make sure you have everything ready to go. This is a quote from Dr. Susan Wasserman. She's the chair of our Medical and Scientific Advisory Committee for Asthma Canada. Flu shots are recommended annually to help reduce the frequency of asthma exacerbations, as viral and upper respiratory tract infections can both cause asthma episodes and make people with asthma more sensitive to asthma triggers. And the flu shots will be available, I'm sure, sometime in October. So another non-allergic trigger is wildfire smoke, and this year was very relevant. I'm sure many parts of Canada. I know in BC we experienced this. We weren't too bad in the lower mainland, but the interior of BC, it was quite severe as far as the smoke. Smoke from forest fires can travel very long distances and affect people far away from the fire source. Even for people without asthma, you think of the smoke and airborne particles can irritate your eyes and your airways. So for people with asthma, it can trigger asthma attacks. Speak with your healthcare provider about having your action plan ready to go. You know, if you know you're starting to have more symptoms, you're heading into that yellow caution zone, and then have it ready to prepare. And put together an emergency kit with extra medications. If there's any chance you may need to evacuate, be prepared. We had some folks out of their home for months this past summer with the fires and the smoke. The Air Quality Health Index is a fantastic tool. It's air quality readings and related health messages. So you can get it as an app on your phone, on the online, and it reports on particulate matter, ground level ozone, and nitrogen dioxide. And it's a scale of 1 to 10. So 1 to 3, it's mild air quality as far as alert, 4 to 6 moderate, and 7 to 10. And so on my phone, on my app, I have it in the 5 to 6 moderate, and it gives me an alert when the air quality gets that poor, as far as it's getting up there as far as not good air quality. So you know what to, may not exercise outside that day. I try to get all my patients to download this and to be aware. Weather changes and cold air. So thunderstorms can affect your asthma. After storms, there are more airborne allergens in the air, which may trigger your asthma. Typically, this happens in the spring on a high pollen count day. So the speculation is massive loads of small pollen allergen particles are released into the air during a thunderstorm. This goes along with the rapid changes in wind, temperature, and humidity. So with the humidity, these pollen grains absorb moisture and then they burst open, releasing hundreds of small allergen particles. And these smaller allergen particles can penetrate deeper into the smaller airways, hence causing an asthma attack. This was interesting in 2016. This is going off topic a little bit, but in Melbourne, Australia, they had this thunderstorm um, that it was a perfect storm as far as high pollen count, high humidity. Well, that storm, they had over 3,000 people admitted to emergency with asthma, and there was 10 deaths. So there's actually been a couple of papers looking at that specific incidence, and so it's more we're aware of it now. So it'd be common in the spring with a high pollen count day and a thunderstorm. Cold, dry air is also a common asthma trigger. Breathing through your nose on cold days helps warm and humidify the air before it reaches your lungs. It's a natural filtration. And then try placing a scarf over your mouth and nose to warm the air. And thanks to our pandemic, with all of us wearing masks across our country, that does help as well. And consider exercising indoors on really cold days to limit your exposure. Emotions and stress, another non-allergic trigger. So intense emotions can be an asthma trigger. Fear, excitement, anger, and stress are all common triggers. I see this often with kids when they laugh really hard or they cry, especially if they're a bit sick already, and that can cause coughing and the shortness of breath and the wheezing. So being aware of that can be a trigger. Medications, so beta blockers, ASA, aspirin, anti-inflammatory drugs, and certain eye drops and blood pressure medications can cause a severe and sudden asthma attack. So make sure your doctor and pharmacist know that you have asthma, so when you're getting a prescription for these for the first time, so they can decide what's the best medication for you and if it could be a problem. Hormones. Some women find that their asthma gets worse before their periods, right before, a week before, during pregnancy, or during menopause. So if this is you think this may be an issue, it might be a trigger, track it. Track your menstrual cycle. There's apps, whatnot, and you can track your symptoms as well and see, okay, women often find that a week before their periods, they find their asthma's a bit worse and it's like, oh, I'm getting my period soon. As well as during pregnancy, uncontrolled asthma poses risks to the baby. So really make sure you're on top of it. Talk to your healthcare provider about keeping your asthma well controlled during pregnancy. Chemicals and scented products. Asthma attacks can be triggered by exposure to chemicals, fumes, laundry detergents is the big one, cleaning products, hairspray, especially the aerosols, anything scented. Many people with asthma are affected by airborne chemicals and fragrances. So if you have paints and other volatile products in your house, make sure they're either really sealed in the garage where you're not with them, living with them, and if you can, try to get rid of them. Scented products. If you're sensitive to heavy perfumes, try not to use them. Try to get stuff that is not perfumey. Laundry detergents are often unrecognized as a big source of asthma triggers. So try to change to all natural, unscented products and avoiding dryer sheets. They're typically full of synthetic fragrances. How can I reduce triggers in my home? Well, starting at your home, making your home smoke-free. Monitor the humidity levels in your home. A damp home will make asthma symptoms worse. Once again, keeping humidity between 40 and 45, you want it under 50%. Keeping your home clean, especially the floor. Airborne particles do settle there, so vacuuming on a regular basis. Monitor your asthma daily. Keeping track, you can do a peak flow meter, asthma diary. There's all kinds of apps now to check. And making sure you're taking your medications on a regular basis as prescribed. And I always say to focus on the bedroom because if you say get rid of all the triggers in your home, it's overwhelming. It's impossible to get rid of the dust. I look at my own home. So focus on the bedrooms, right? Focus where you spend your time sleeping. So some common questions we get: how effective are indoor air cleaners? If you look on asthma and allergy friendly certified products, they're designed and tested and certified to help people with asthma and allergies. And I think we can get Kristen to put up the link at the end as far as where to find a list of the products that are recommended. HEPA, the high efficiency particulate air filters, they remove airborne particles. They say 99.97% of point or zero point 0.3 microns in size. So it's not clear how effective these machines are at reducing asthma and allergy symptoms. And you shouldn't count on them to clean your house and make sure your air is clean, doing all the other measures as well. But a lot of people do find they help. Another common question: should I get a humidifier? Well, personally, here living in BC in the rainforest, I've never thought of it. If your humidity is less than 30% and you're starting to see signs of static electricity in your home, frequent nosebleeds, that's something to consider if you're having issues, if you're having symptoms with low humidity. Um, just remember to keep it clean because they can harbor bacteria and mold. Cleaning them on a regular basis is really important. A hygrometer is that measures humidity, and you can buy them at hardware stores. What is indoor air particulate? Any small pieces of material that are floating in your home is indoor air particulate. Animal dander, pollen, dust, chemical substances, mold spores, outdoor air particles. The Breathe Easy Trigger booklet on the Asthma Canada's site, or the booklet, has tables just like this one on how to reduce triggers in your home based on rooms. So the bedroom, living room, kitchen and bathroom, and then there's the backyard, basement and shed. Have a look. These are really good, and there's some really good pointers on these tables, specific tangible things that you can do to help get rid of some of the triggers. I'll just go through a couple of them on each of the charts. So for the bedroom, I think they all talk about carpets. Replace carpet with a hard surface such as wood, tile, hardwood, linoleum, and then use small area rugs that are easier to clean. Stuffed toys. I always tell the kids, stuffed toys, keep a couple in your bedroom, in your bed, if you sleep with them, but make sure on a weekly basis you clean them. If you can put them and launder them in hot water, great. Dryer heat kills dust mites. Stick them in the dryer for half an hour. And some of the stuffed toys you can't put in the dryer or wash because they have, like, we had the Build-A-Bears back when my kids were young, and it destroys them, or the wind-up ones. So you can stick them in the freezer for the day. Put them in a linen bag, stick them in the freezer. It's not as effective at killing dust mites, but it does help. And pets, of course, keep the pets out of the bedroom. That is the big one. When I get somebody in the clinic and their asthma's out of control and they sleep with their pet on their pillow, well, what do you do? The next one is the living room. I think the same thing. The big one is carpets, getting carpets out, or cleaning on a regular basis. Wood smoke. Do not use a wood stove or fireplace. I know some people have no choice, but there is a particulate matter that goes along with that. Just being cautious. You may have to clean a lot more if you do have one. And getting rid of old moldy papers, newspapers, magazines. Kitchens and bathrooms. Mold, getting rid of mold in the refrigerator, on the surfaces, especially in bathrooms where it's can be quite humid. Yeah, keeping everything clean. Your basement, garage, and yard. Get rid of all the chemicals if you can, what you're not using. We all tend to keep things that we're not going to use again. And if you are keeping them, make sure they're well sealed and they're in a ventilated place. As far as plants, try to plant lower allergen, less pollen producing plants in your yard if that's an issue. Avoid going outside between 5 and 10 a.m. on hot, windy days when the pollen count is high. That's usually when pollen is the highest in the day. And carpet and basements, they don't recommend as well. Of course, any carpet they look at. So how do we manage our asthma triggers? First step is finding out what your triggers are. Have an allergy test. Talk to your doctor. Get an allergy referral to a specialist. Write down what you are allergic to and learn how to avoid or reduce your exposure. Keeping track of your symptoms and review your symptoms with your healthcare team. Once you have a clear idea of the things that make your asthma worse, you can make a plan to control these things moving forward. Many triggers are avoidable. And I often say we start with your home, start with your bedroom, first thing to look at. Planning ahead. Once you have a clear idea of the things that make your asthma worse, take action and make plans to control your exposure to these triggers. Since some asthma triggers are impossible to avoid, it's important to always carry your rescue medication with you, your reliever, Ventolin, Salbutamol, Aeromir, whatever you have, just in case of a trigger causing an asthma attack. And follow the basics, back to basics. When it comes to living with asthma, it's important to follow the asthma basics to help minimize asthma symptoms and the possibility of an attack. Taking your medications as prescribed, your controller medication, your inhaled corticosteroids, to keep your asthma under control and decrease the chances of having a flare-up. Carrying your rescue medication with you at all times, especially if you're struggling, or snuggling, it says snuggling with your pet, or I'm struggling with your asthma. If you're having more symptoms, make sure your medication's with you. And follow your asthma action plan. That's a very important tool. And know what to do in case of an asthma attack. And I think we're going to go to questions and answers. We'll be happy to take any questions.
Wonderful. Thank you so much, Stacey. Yes, feel free to type any questions into the chat box. But I think the first one we'll do here is a question we received from Sam, which this is great. So does cooking trigger an asthma attack?
Um, any strong odors, fumes can, definitely, right? Um, I'm assuming cooking here in Canada, right? I see some patients that cook some ethnic groups and they cook over wood stoves or the more fire-based. That is definitely a trigger. But overall, if a lot of the stronger odors and fumes and sometimes the steam even, that can definitely trigger an attack. So just be cautious of that.
Excellent. Another one, this one came from Beth. And Beth asks, will pre-season allergy shots help me with tree nut and peanut allergies? This is a great question. I know my partner struggles with ragweed allergy, and every year we think, should we do the shots? So I'm looking forward to this answer.
Unfortunately, I think I have to defer this to an allergist. That's a really good question. And yeah, um, personally, I took the allergy shots when I was young, and they worked for me, and a lot of my patients are on them. And so what we do is if there's any concerns is we refer to an allergist. Um, I think that would be the best way because they're the ones that can figure out which shots specifically are going to work. They can fine tune it. They're doing a fantastic job with that. So definitely follow up with your doctor.
Nope, that makes perfect sense. So May has asked, can one have both allergic and non-allergic asthma?
Definitely. Because I think I went through that with the presentation as well, but the allergic triggers are set off by the allergies typically to the dust mites, the pets, the pollens, right? So you can have that. Then the non-allergic triggers usually by cigarette smoke, cold air, exercise. So they're very different, right? And often asthmatics have both. They have the allergies. They have to try to avoid what they're allergic to. And the allergies is what causes a lot of the inflammation, which causes the symptoms of asthma. And then you have your non-allergic things that you have to work at avoiding as much as possible and working with. Exercise, if your asthma is well controlled with your medications, you should have no concerns. Some people find taking their rescue medication before exercise helps get them through that workout. So that's a good question, but definitely a lot of people have both allergic and non-allergic. I hope that answers your question.
I think so. May's live with us, so absolutely, May. If I think that was a really good answer. I'm not sure if you'll have the answer to this one, but Deborah had asked if any tips for how to get in to see a specialist to update her asthma medications. She's saying this year's been really difficult with the extreme humidity, the high pollen count, and like you mentioned, obviously during the pandemic, accessing can be difficult. Any tips?
Yeah, we're having difficulty with our area. We've had a couple of family doctors leave, retire, and there's patients without a doctor. So a lot of nurse practitioners are now taking patients in our area. I'm not sure where you are as far as, yeah, that's a hard one. Yeah, a lot of people going to walk-in clinics to get referrals helps if that's available. We have urgent care as well. Looking at what resources are available in your area as far as trying to get that referral, because you don't want to leave it. We often see people that are missed, their doctor's not there, they can't get in, they can't get the new referral to the specialist. In BC, you have to get a new referral every year typically, and then things get out of control and they end up in emergency. And that's what we're trying to avoid. So a lot of work I do is advocacy, is try as brainstorm how to find someone to talk to get those referrals. That's very convoluted, but I'm sorry, it's not easy right now.
No, that's an excellent answer. So Barry is asking, and this with your experience as a tobacco educator. So he's asking any effort to educate the provincial and municipal governments to stop smoking on the street. It's a huge, huge trigger for him. So if, the political aside, if there's any insight into that.
Sadly, no. Wouldn't that be nice? I know. Um, I know. I'm with you. It's a trigger for me as well. And I find even the marijuana smoke as well. You walk past, and that's quite prevalent right now here. I I don't have an answer to that, unfortunately.
That's fair enough. I do have another question here from Myrna, who asks, can a person have a severe asthma attack that resembles anaphylaxis, or is that just connected with allergies?
Um, Asthma and allergies are related, right? They're not the same thing. Anaphylaxis is a type of allergic reaction, and it's severe, can be life-threatening, requiring immediate medical attention. Um, I think you would know. I think severe asthma attack should be, if it's severe and you're in that red zone of your action plan, definitely seeking medical attention, right? Anaphylaxis, you should be seeking medical attention. So I think they're both severe enough. They can be triggered by different things. Anaphylaxis, yeah, I think they're both, I'm not sure if I'm answering the question, but they both need to be taken very serious.
No,
What do
that's
you,
that's great.
okay.
Um, Sorry, I'm just let's see. So Madeline has asked, so her biggest trigger is air conditioning. And obviously with the increase in warmer temperatures, do you have any suggestions about that particular trigger?
Well, we could all move. I don't know. That's a tough one. Everything's getting hotter. We had such a hot spell here as well in BC this summer, and we had so many people sick and pass away from the extreme our heat wave. I don't know. But a few of my, 'cause with my pulmonary rehab patients, a lot of them don't have air conditioning in their places. They're living in senior centers or condos or whatever. So, one of the suggestions, instead of having an air conditioner, is a big bowl of ice water, and having a fan blowing over that. That's not as triggering to some, I find. I encourage some people to have their air conditioner on when they weren't home. So when they got home, their place was cooler, and if you have central air, that's difficult because it's through the whole home. But if you have more the portable units, not putting them where you are, out of the bedroom, right? That's a difficult one because and in the car as well, same thing. Some folks turn their car on before they get in, cool it down, and then get in and just have the fan going. Not
No,
sure.
I've never that's a great suggestion to try. Absolutely. Okay, so I think please feel free if anyone else has any further questions, but I think we'll probably do one more and then wrap up. So this was a question that came in advance, so the presentation might have answered this, but Rosario asks, why is it that when I get sick, I get bronchitis and then I get asthma?
That's a really good question. So often for asthmatics, one of the triggers is a respiratory infection. So you get a bug of some sort, and for asthmatics, it tends to go straight to the chest. And then you end up with this lingering infection that you cough more, short of breath. It may linger longer than somebody else who got the same bug as you. And yeah, so that's quite common. The key with that is to make sure your asthma is well controlled as a baseline. So if your asthma is very well controlled, when you do get an infection, it hopefully won't get as deep. It won't get as lingering. It won't turn into such a bad bronchitis. For example, with a few of the kids I work with, if I get them on their controller medication on a regular basis, they're still going to get colds. They're kids and they're exposed to whatever at school and daycares. But when they get the colds, they don't tend to be as severe. They don't tend to get as deep. So I think working on getting your asthma really well controlled will help with that.
Fantastic. Okay, I'm just going to quickly, sorry, bear with me. I'll just double check. Oh, Sam has another question. So if it's okay, we'll take that one. And Sam asks, can asthma really ever go away? Is there any medication that can treat it for good?
There's no cure for asthma, but often when it's childhood asthma, especially early onset, we call them early onset, early wheezers, they often outgrow it. But it often comes back as adults. Now we're seeing adult onset asthma on a regular basis. We see a lot of adults coming in and they're like, I've never had asthma before. I have no family history. What is going on? Who knows why it's here now, but here we go. And we look at our environment. You look at everything we're exposed to. There's a really good booklet, Asthma Canada, I helped work with, and I think it's called Asthma in the Older Adult. They were going to talk at asthma in seniors, and I said, no, don't do that. It's asthma in older adults because I have asthma as well, right? And I'm not a senior. So anyways, have a look at that booklet. That's a really good resource as well to have.
Yes, absolutely. At the resource section of Asthma Canada, it's called Living Well with Asthma as an Older Adult. So yes, absolutely. Okay, so yeah, that was a good round of questions there. So if you think of something after the presentation, please don't hesitate to reach out to us. You can email info@asthma.ca. As well, we have our asthma and allergy helpline, which is a free and bilingual service. So you can call that number as well, and we'll connect you with a certified respiratory educator. So yeah, Stacey, thank you so much. We appreciate you taking the time to give us this presentation, and thank you so much for everyone attending. Yeah, I think we'll end it there. Can't thank you enough, and thanks everyone for watching. Take
And
care.
thank you, Asthma Canada, for having me. And once again, you guys reach out to the certified respiratory educators through the Asthma and Allergy Helpline. They're there to answer any questions and give you support. Take care, everybody.
Thanks so much, Stacey.